Hello, myself Dr. Shah, and today I am going to discuss regarding antimicrobial resistance. So we are going to divide this topic into five segments. First segment is antimicrobial resistance definition. Second segment is antibiotic resistance persistence of the bugs. Third segment is resistance to the resistance. Fourth segment is success stories, and the fifth segment is all for the action. So let us discuss regarding first segment is antimicrobial resistance definition. So what is antimicrobial resistance? It is nothing but the resistance developed to the antimicrobial drugs with the bacteria. So these drugs are no longer used for the treating infections. And now let us discuss regarding causes of the antimicrobial resistance. So the causes of the antimicrobial resistance are poor infection control practices, then overuse and misuse of the antibiotic drugs, then the genetic adaptation and the resistance genes which are transferring from one bacteria to another bacteria, and the fourth cause is lack of new antibiotic generation. Discuss consequences of the antimicrobial resistance. Increased morbidity and mortality of the patients. There is less chances of getting infections. There is increased list of untreated infections, and also longer hospital stays and higher healthcare costs. Let us discuss the second segment, the persistence of the superbugs. Here we are going to discuss how bacteria develop resistance. So first, natural selection and genetic adaptation occurs. Then the resistance gene transfer from one bacteria to the another bacteria. And the last step, the mutation occurs in these resistance genes. So let us discuss few examples. Methicillin resistance Staphylococcus aureus, multi-drug resistance tuberculosis, Candida auris, and Carbapenem resistance bacteria. Then let us discuss the result of these superbugs to the public health. So infection occurs which are untreatable, longer hospital stays, and increased mortality and mortality of the public. Now let us discuss regarding the third segment, which is resisting the resistance, in which we are going to discuss regarding the strategies to prevent this resistance. So the strategies are improving vaccination and immunization, improving infection control practices, then improving the infection control antibiotics and development of newer antibiotics and treatments, and also improve the diagnostic skills. These are the strategies. The role of individual in antimicrobial resistance. So we can do the hand hygiene and infection control. We can encourage the research of the newer antibiotics and treatments, immunization and the vaccination, and the supporting the AMR research and development. So the fourth segment is success stories and the challenges. Example of the success stories are reduce antibiotic use in agriculture industry by implementing the best practice at the agriculture industry and using of the substitute of it. Next example is improved infection control in healthcare setting by improving the hand hygiene and other usages, and also there are many antibiotic research in the healthcare industry, and also the best practices of the antibiotics. Now the challenges will be discussed. Few challenges are lack of funding, lack of investment for the antimicrobial research, lack of awareness to the general people and healthcare workers, and lack of use of diagnostic tool, and lack of diagnostic technologies. So to come over these challenges, reviews were taken from the patient, their families, and healthcare workers, and the success stories were also reviewed. So, final segment, fifth segment is call of action. How we can act on resist to persist. So here are the few points. First point is we can contribute to the antimicrobial research by participating in the awareness and the campaign, and also by donating them, and also getting fund from the organization like WHO, CDC, and Antimicrobial Resistance Center. And also other thing we can do is hand hygiene, and also the better practice of the antibiotics and use of best diagnostic technique and diagnostic tool to diagnose disease and use of particular antibiotic on the particular disease.